Is Kheya Ganguly, and I am the Director of Trauma Prevention and Resilience Development for the state of Vermont. I am based out of the Agency of Human Services and sit in the Department of Mental Health. Um, Today, we're going to talk a little bit about seasonal affective disorder. Once I put the slideshow up, I'm not going to be able to see you easily, but I will try to break and check for questions or comments wherever I can. Out of curiosity, how many of you, and you can just raise a hand, how many of you either deal with seasonal affective disorder or know someone who does?
Lots of hands.
Yeah, I can see. Yeah, this is definitely something I think we deal with quite a bit. Yeah, and you can put your hands down, but you can see, most of us either know someone or deal with it ourselves. So I'm going to put this slideshow up. Can you see my screen?
Yes.
Okay. So, seasonal affective disorder. Let me just pull this other thing up and then there we go. All right. So, seasonal affective disorder, or otherwise known as SAD, is a type of diagnosable depression. So, it's not just the winter blues like people say. Um, it is seasonal. Interestingly, um, there are some people who get it in the spring and summer, a much smaller subset, but there are some who do. Women are more affected by seasonal affective disorder than men. They're 1.5 times more likely to be diagnosed. But interestingly, too, this usually starts in adulthood, and we're using 20 as that. So it's rarer in people under 20, but when children are diagnosed, it's actually more likely to be boys. So now, SAD is, of course, more common in the north, where there are fewer hours of sunlight in the winter than the south. And we're talking about the northern hemisphere. So, for example, about 1% of people in Florida compared to 9 to 10% in New Hampshire when you're talking about diagnosis. But since SAD is rarer in the South, people who are less likely to recognize it or, seek help. So, what are some of the symptoms? Feeling listless or sad or down most of the day, nearly every day. Losing interest in activities you once enjoyed. Having low energy and feeling sluggish or sleepy, and having problems with sleeping too much. People can experience carbohydrate cravings, overeating, weight gain. There's difficulty concentrating. There can be feelings of hopelessness, worthlessness, or guilt. There are people who report thoughts of not wanting to live, so suicidal thoughts, daytime drowsiness. Some other things are things like social withdrawal, increased sensitivity to rejection, grouchiness, anxiety, decreased sex drive, decreased ability to focus. And some people report physical problems like headaches. Um, it seems that, and again, we don't necessarily know specific diagnosis, but the neurotransmitter serotonin in our brains seem to be involved in some way in the abnormal regulation of mood and food intake. So that is one reason why people may be craving carbohydrates or gaining weight. Interestingly, for seasonal affective disorder, premenstrual syndrome, PMS, and I don't like this name, but this is what they call it, carbohydrate craving obesity. All three of these syndromes are characterized by episodic bouts of increased carbohydrate consumption and depressed mood. So, if you just something to think about if this is something that you struggle with. Now, if you're looking specifically at seasonal affective disorder symptoms in the fall and winter, so oversleeping, so sleeping too long, even when you wake up, you're tired, falling asleep during the day, appetite changes. So either, again, experience carbohydrate cravings, overeating, um, and this tiredness is a huge piece because tied into that is that difficulty concentrating, feeling hopeless, just really challenged and, like some people say, down in the dumps. For those people for those people, however, who have symptoms in the spring and summer, we're looking at insomnia and problem sleeping, um, poor appetite, so you're not hungry all the time, weight loss, agitation, anxiety, irritability. So you can see the two syndromes are different. The one caveat being when you're in the southern hemisphere, spring and summer are when they have their so-called winter. So things can change a bit. So what are the causes? Specifically, we do not know what causes seasonal affective disorder. But there are some factors that we can think about. One is our biological clock or our circadian rhythm. And what people think is, your body responds to length of days, and that there is, when the days get shorter, there's a disruption of our internal clock. I can tell you personally, when I lived in Florida, and I was there for quite a while going to grad school and after, the days always seemed weirdly long, and it got light much later in the morning than I was used to. And it just never seemed right. So my internal clock was definitely set up here. Serotonin is a factor, and reduced sunlight can affect serotonin in our bodies. And melatonin also can have some effects. Our body naturally produces some, and the changing in light can actually change the levels we have in our bodies. Any questions yet or comments? And you're welcome to put them in the chat too if the chat is on. If not, feel free to unmute yourself and ask. Okay.
So somebody wanted to know if they could get a copy of the slide deck.
Yes, I will
definitely
make
are.
sure.
What's that?
I said I'll make sure I send it to y'all so you
Okay.
can hand it out.
Terrific. And we are recording this.
Okay.
And Kheya, I was just gonna say, recently my naturopath has told me, as far as getting light, that she wants me to go outside every morning for at
Yeah.
least 15 to 20 minutes, even when it's cloudy, without my glasses on. And
Yeah.
she said specifically that, and that was a piece I didn't really know, so that's why I'm just throwing it in there, is that like the quality, the light, the way that your brain kind of reads the light and the quality of the light getting into the eye, the brain through the eyes, is it getting it through a window, getting it through your glasses is not as effective as just basically basking like a lizard.
Yeah, we're going to talk about that as we go on. I
Okay.
actually have a whole thing about it.
Ah, beautiful. Okay, great.
Okay. So let's get this back up so I can see it. So what are risks? There are actually risk factors. People who have SAD um, are more likely to have blood relatives with SAD or another form of depression. So family history. Having major depressive disorder or bipolar disorder. Symptoms of depression may worsen seasonally if you have been diagnosed with one of these two conditions. Living far. Oh, and before I go on to that, I also want to say people who are diagnosed with bipolar disorder may also have increased risk of, like I said, seasonal affective disorder. But in some people with bipolar disorder, episodes of mania may be linked to a specific season. For example, spring and summer can bring on symptoms of mania or a less form of mania, hypomania, anxiety, agitation, and irritability. So part of that piece can play in. Living far from the equator. Like I said, SAD is more common among people who live far north or south of the equator. And this is due to decreased sunlight during the winter or longer days in the summer months. And then low level of vitamin D, because some vitamin D is produced in the skin when it's exposed to sunlight. And vitamin D boosts serotonin activity. So less sunlight and not getting enough vitamin D from foods and other sources can result in low levels of vitamin D in the body. And as a hint, I can tell you I have low levels of vitamin D, and it's something my physician tests for every year when I get my yearly physical. So it is something you can actually ask to have assessed. So, what are complications associated with seasonal affective disorder? Like I said, social withdrawal, which is a huge one because I don't know if you know, but our last Surgeon General released a report on an epidemic of loneliness in this country, which seemed to be linked with COVID because social activity has not quite bounced back to where it was before. So if you have seasonal affective disorder and you're already struggling with social connection, this can complicate it even more. You can experience school or work challenges. Again, trouble focusing, concentrating, completing tasks. People who have seasonal affective disorder can use substances at a higher rate than the general population as a coping mechanism for how they're feeling. As I said, there are other mental health challenges. There is anxiety. There are also eating disorders, binging, and other types of eating disorders can really be triggered. I don't like that word. They can be activated a little more, especially if you're already struggling with some type of eating disorder. And then we see an increase in suicidal thoughts and behaviors. So not only do people think more frequently about suicide, they may actually act out on those thoughts at a higher level. Okay, now I've made everyone down in the dumps. How are we going to treat this? So, first of all, exposure to sunlight. Spending time outside or near a window can ease symptoms. And yes, there are some research studies talking about refraction through glass, but there isn't one definitely proving it or not proving it. So there's not enough research on that yet. But I can tell you there was a meta-analysis of about 170 plus depression studies, and they did find that the most effective treatment for depression is sunlight. So, in other words, be a plant for about 20 minutes at least a day. If increasing sunlight is not possible, exposure to light for a certain amount of time each day can help. And there are specific light sources, which I will talk about in the next slide, that are best for seasonal affective disorder. Therapy. Cognitive behavioral or interpersonal therapy helps change distorted views you may have of yourself and your environment. It can also help you improve interpersonal relationship skills, so hopefully you're not withdrawing as much. It can also help you start identifying stressors, because stressors can also feed into this. And especially when you talk about cognitive behavioral therapy, it can really help you make active changes. You can also, depending on how you feel, use antidepressants and or other meds, because you may need prescription meds for depression. You may need them for anxiety, or both. You may actually want to increase the amount of vitamin D you're taking as a supplement. But any recommendations I'm making, I would urge you to talk to your physician, even for the vitamin D. So let's talk about light. So before I get into detail about this, here's what I would tell you. My husband has severe seasonal depression. I did not realize what was going on in the first year we lived together, and he pretty much grunted at me from November to February or January. I almost left him. I had no clue what was going on. And the years went on, he learned to sort of manage it, but he's always down in the dumps this time of year. And then about 4 years ago, I was at my sister's house because I stay up there when I'm up in Waterbury. And I woke up in the morning and she was sitting in front of this bright white square. And I'm like, what are you doing? She's like, oh, I sit in front of this because of my depression. And I'm like, and she's a mental health counselor. And I'm like, does that really work? And she's like, absolutely. So I was like, I went tap, 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 and went onto Amazon and ordered one. And I went home and I went to my husband. I'm like, baby, looking really pitiful. He's like, what? He looking at me very suspiciously. I'm like, would you sit in front of this every morning? And he looked at me and he's like, first of all, what is it? And I explained. And he was like, really? I'm like, let's just try it. So he did. First couple days, no change. Day 3, nothing. Day 4, my summer husband was back. It was a dramatic change. And to the point where I don't even tell him. In fact, last night we were sitting there, he's like, I gotta find my light. It's getting to be that time of year and I'm starting to struggle. So, anecdotal, but that's what I've experienced. But there are some parameters when you're looking at lights. First of all, you're going to want a fluorescent light box with diffusion screens. The standard light intensity recommended is 10,000 lux for 30 minutes. For some people who that might be too bright, the alternative that's been suggested is 2,500 lux for 1 to 2 hours. The wavelength on your light needs to be full spectrum visible light. The light source position, this is important. The light bulb needs to be angled about 30 degrees from your line of sight or gaze. Do not stare directly into the light. Illumination, which is measured in lux, is dependent on distance. So the user sits at a distance recommended by the device. So you really need to look at this stuff carefully. Not just any light's going to work. You need to figure out where you're going to put it and how far you're going to be from it. Treatment duration. Research suggests symptoms should abate within a week. It may take a little bit longer, and stopping it may lead to relapse or falling back into, you're feeling great. You're like, oh, I don't need this anymore. Yeah, you do. And the recommendation is to begin in the fall, just like my husband said, and continue through winter until you have an increase, you see the days getting longer. So there are some treatment variations. They're not as effective as using a fluorescent light box, but one is dawn simulation, a gradual increase in bedside light in the morning. I have a friend who does that, who finds it very effective for them. They've got one of those alarm clocks that slowly brightens to wake you up and plays bird sounds and stuff. And he finds that really effective. So, evening treatment, that is definitely not proved as effective. But for people who awaken normally and don't feel like super tired or, groggy, some people prefer the evenings, and they'll do 1 to 2 hours of the lesser light in the evenings, but you need to end at least an hour before you go to bed so that your body's rhythms allow for that. Side effects from this have been found to be minimal. People may report some eye strain, um, nausea, headaches. I'm sorry, I see that it cut part of this off, so I do apologize for that. But just know that patients with glaucoma, cataracts, or any type of retinopathy, anything with your retinas, need to be under supervision of an ophthalmologist. People who have photosensitivity need to be careful. So if you're sensitive to bright light, or look at the medications you're on. Specifically, I'm thinking about antibiotics, but I'm also on some meds I'm that preclude me from taking this because I have lupus, and some of the meds I have require that I am out of the sunlight. So just think about these pieces before you do anything. So what can you do? Get help. If you think you might be depressed, see a healthcare provider as soon as possible. Set realistic goals for yourself. Don't take on too much thinking you're going to feel better immediately. Because when you get overwhelmed, it can create this cycle where you fall into deeper depression. So break large tasks into smaller ones, because sometimes looking at a big task can just feel like too much. Set priorities and do what you can as you can. Be with somebody. Confide in someone. It it does help because people tend to sort of put on social masks too, and being truthful with somebody is really important. Do things that make you feel better. Go to a movie, gardening, playing with your plants indoors, starting plants for the spring, taking part in spiritual, social, or other activities. And honestly, doing something nice for someone else can make you feel better. Regular exercise as you're able can really help. I find dancing, because dancing just makes me happy, super helpful. I put music on and dance around the kitchen while cooking or, doing dishes. Expect your mood to get better slowly. This didn't happen overnight. It's not going to get better overnight. Try to eat, and again, I don't love the word healthy, but nutritionally dense, well balanced meals. Try to stay away from alcohol, illegal drugs, legal drugs. Watch what you're doing because they can make depression worse. So if you have prescriptions that are depressants, you may want to talk with your physician about that. Delay big decisions until your depression has lifted. Don't make a big change right away, like getting a new job or getting married or getting divorced just suddenly. Talk it over with people who know you well. They may have a more objective view of your situation. And again, you don't snap out of this overnight. It's incremental, day by day, and try to be patient. So focus on the positives. It may help, if there's science that shows engaging in gratitude, in awe, and joy are all things that could help with depression. And I'm actually putting a training together on the three of those that you'll be able to see soon. Negative thoughts will go away as your depression responds to treatment. So just let your family and friends help you and don't try to muscle through this. Finally, the light boxes we were talking about. This is the other specific thing. Sorry, my slides were out of order. But look for a screen size of at least 200 square inches. And again, 10,000 lux of illumination. There are devices specifically designed for SAD, and they emit white light, which is what you need. The reason we say 10,000 lux is this mimics a sunny day. The thing you have to be careful about is other types of light therapy are mainly used for treating skin conditions and may use UV light. You definitely want one that has a UV filtered screen to protect your eyes and screen. Other features you can have are dimmable brightness and adjustable angles that will allow for a more comfortable and tailored experience. And some ones have timers and automatic shutoffs. All right, so I sped talk through that because I knew we only had a half an hour, so I apologize. I'm going to stop sharing my screen, and we've got about 4 minutes left. So, questions, comments, anything like that. And I apologize for that mix-up of those last two slides.
Hi, Julia here. I was just wondering if you have any recommendations for brands or like where to find the lights that you're recommending. It's okay if not. I was just curious.
Actually, there is an article. Hold on, let me see if I still have it up or not. That I was looking at yesterday. Now let's see. And some of them are more expensive than others. There is an article on health.com about let me see if I can get in the chat. And I'll put this in the chat if it'll allow me, because I don't see a button for the chat for some reason. All right, I will make sure I send it because I don't seem to be able to access the chat for some reason. There is a website on health.com. You could simply Google if you wish. What did I Google here? Light boxes for SAD, and it'll pop up the article. And there's some actually pretty good recommendations in there when I started looking around. Mayo Clinic also has something on picking light boxes and what to consider. So, but I will definitely send those links along with the PDF. Other questions?
How do you differentiate between introversion and social withdrawal?
I think if you look at, because I'm an introvert, okay, that doesn't mean I don't like people. If you're withdrawing even from the people you would normally spend time with, then that is withdrawing. Introversion to me is more, how do you get your energy? I recharge by spending time by myself, but that doesn't mean I don't love spending time with people or doing trainings or anything else. I do. I just know that my social battery only has so much charge, and I've got to pick carefully where I'm going to spend it. Does that answer the question?
I guess so.
Yeah. I mean, that's the best way I can tell you, Kay. It's everybody is so different. The big thing is, let's say you normally have a very close group of friends that you chat with via text regularly, and you stop doing that. I would say that's withdrawal. But you hate talking on the phone. Okay, you're allowed to hate talking on the phone. Do you see what I'm saying? It's like, what is your baseline? Because everyone's
Oh,
is
so
different.
figure out your baseline and not relate it to how do you recover.
Exactly.
Okay. The other thing how are the relationships between from the very first slide correlative or causative when in terms of risk factors?
Um, they're not necessarily causative, but there are definitely correlations there.
Okay. The other thing is, I'm pretty sure you can get a higher vitamin D test rating if you take collagen.
Mm-hmm.
Pretty sure that, and also if you use retinol on your skin, I think that'll make you more photosensitive.
Yeah, but it also depends because for some people like me, I can't get more photosensitive because it will affect my meds, which is why I always say talk to a doctor
Yeah.
before you
Okay.
start doing supplements.
Okay. Thank you.
Yep. Any other questions? All right, then I think we're a minute over. Am I right? I think we only had a
Yes,
half an hour to go. So sorry to
you
keep
did
you late.
great.
So if you have any questions, feel free to email, just like all of you. It's my first name dot my last name at vermont.gov. And I'll turn it back over to you, Mara.
Well, thank you so much. This was really informative, a lot of great information, and we really appreciate you taking the time to meet with us.
Anytime. Have a good day, everyone.
Yeah, you as well. Take care.
Bye.
Thank you.